So many essential workers have been bravely working on the front lines throughout this pandemic. And one of those heroes is Audrey Scott, Assistant Nurse Manager of Emergency Medicine at Hartford Hospital. Hi, Audrey. Thanks for being with us.
Thank you so much for having me today.
It's been great talking with you throughout this. First, tell us about how you and your colleagues in the ER are doing after 2 months of fighting on the front lines during this pandemic.
It has definitely been a challenging time for us, but we've really come through it stronger as a team. Everyone's been relying on each other, checking in with each other, and just feeling the support from our families and the community. I would say that we're all going to come out on the other side better caregivers and better nurses and doctors and all the specialties because of this crisis.
You guys have been totally amazing. Well, there was an observation unit that was turned into a critical care unit in the ER. Is that still operational as an ICU? Tell us the status.
It is not currently an ICU. Once those needs diminished and the ICU patients throughout the hospital, the number decreased, we were able to shift that unit back to its original purpose, which was an observation unit that was scheduled to open in the spring. With the current crisis, we are keeping it as an ED overflow unit, as we call it, so we can still flex it for whatever's needed and accommodate the needs of the patients and their level of care.
Okay. Talk about how your job has changed as a result of COVID-19.
I think there are the obvious conversations about the PPE and working behind masks all the time and having to get used to that. But I think just on a day-to-day basis, the ED normally prepares for what's to come, but this has been on a completely different level when it comes to constructing new spaces and changing how we staff the unit and everything like that. And the adaptability and flexibility of the staff has been incredible. But I think again, we're going to come out as better caregivers because it's just giving us a different perspective on our job and how we care for these patients, especially behind the mask and making those connections with people.
Oh, so true. And let's talk about overall, what have you learned throughout this entire experience?
I think, first of all, just the incredible nature of people and how good people are. All of the support we've received this entire time has been mind-blowing. We've learned the importance of making deeper connections with patients because everything in the emergency room it tends to be fast-paced and snapshots of time, but when they don't have their families there and we're behind all this gear, we're having to find different ways to connect with patients. So the level of care that we're giving, I think, is even better. And then just learning about our team and the importance of wellness and supporting one another. Again, we've always had an incredible team, but now more than ever, we truly are just proud of what we do.
Oh, and you should be. You are all that patients have or had. It's been amazing watching you guys, and you know, we are in total awe of you. Audrey Scott, thank you so much for sharing your story with us today and checking in. We appreciate it.
Thank you so much.